Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, a young lady presents to the office with complaints of copious vaginal discharge and no cervical discharge on per speculum examination. Which of the following would be the management? No cervical discharge, but there is copious vaginal discharge. Here, the patient will have metronidazole and fluconazole are given for the management. Then, cervicitis is caused by Staphylococcus, chlamydia, and Neisseria gonorrhea.
In the previous question, metronidazole and fluconazole is given because metronidazole will cover bacterial and trichomonas vaginalis, whereas fluconazole will cover the candida vaginalis. So, as an empirical therapy, metronidazole and fluconazole can be given for vaginal candidiasis.
Then, minimal criteria to diagnose PID are: for PID, there should be lower abdominal pain, cervical motion tenderness, and adnexial tenderness are minimal criteria to diagnose PID.
thank you and thank you for watching.